Hi guys, my name is Allison Ellis, and for my Pills, Potions, and Poisons class, I chose to talk about physician-assisted suicide. The goal of this video is to clear up some of the controversial concepts associated with physician-assisted suicide, and also to discuss how it affects the pharmacy world. Let's start with what is physician-assisted suicide. MedicineNet.com defines physician-assisted suicide as the voluntary termination of one's own life by administration of a lethal substance with the direct or indirect assistance of a physician. In the United States, physician-assisted suicide is only legal in Oregon, Montana, Washington, and Vermont, and laws restrict it to terminally ill and mentally competent adults. There are also several qualifications that a patient must meet. First, they must be 18 years of age or older, a resident of a legal physician-assisted suicide state. They must be capable of making and communicating healthcare decisions for themselves, and be diagnosed with a terminal illness that will lead to death within 6 months. The patient's attending physician must determine whether these criteria have been met. It is also required that the patient orally request the medication at least twice and provide at least one written request. Now that we know the details of physician-assisted suicide, let's get into the controversy. Those who are for physician-assisted suicide have coined the phrase death with dignity. Patients who request physician-assisted suicide are looking for a dignified and respected way to die instead of battling out 6 months as they fade away as their disease evolves. Another reason people are for physician-assisted suicide is that it minimizes suffering for patients. Terminal illnesses can be hard-fought battles. For many of these patients, it's seen as a needless cruelty to force them to suffer when there's a possible alternative available. Conversely, there are those who oppose physician-assisted suicide and can do so on the basis of medical ethics. For a physician to be so invested in the welfare of the patient to willingly allow suicide goes against their nature to first do no harm. Along with medical ethics, there are the religious morals of the physicians that must be taken into account. To provide the patients with the means of ending their own life is analogous to killing in some religions. Personally, I believe physician-assisted suicide is a viable option for patients who are terminally ill and are in a competent mindset. This is because I think that patients who are completely coherent and understand their disease and their terminal illness should have the right to decide when they should die. The New England Journal of Medicine, April 11, 2013, conducted a survey of 114 patients who inquired about the Death with Dignity program at the Seattle Cancer Alliance between March 5, 2009 and December 31, 2011. A direct quote from the results is, of these, 44 did not pursue the program, and 30 initiated the process but either elected not to continue or died before completion. Of the 40 patients who, after counseling and upon request, received a prescription for a lethal dose of secobarbital, all died, only 24 after medical ingestion. The participants at our center accounted for 15% of all participants in the Death with Dignity program in Washington. A CNN article, Physician-Assisted Suicide Fast Facts, states that according to the 2013 annual report, since 1997 in Oregon, prescriptions have been written for 1,173 people, and there have been only a reported 752 deaths. These statistics and others like them support my opinion that physician-assisted suicide will not be an overly used and abused alternate route for patients. With the diminished possibility for abuse, I believe that physician-assisted suicide is a respectable and dignified alternative for patients who are looking to escape the suffering and the turmoil associated with their terminal disease. The question is, now how does physician-assisted suicide affect pharmacists? The American Pharmacists Association does not endorse a specific moral position on the issue of physician-assisted suicide, but allows pharmacists' professional judgment under certain circumstances. Pharmacists are allowed to conscientious objection or a refusal to participate in activities that they consider to be against their moral, ethical, or religious beliefs. The Pharmacist Conscientious Clause, supported by the American Pharmacists Association, recognizes the pharmacist's right to conscientious objection. However, patients must always have access to therapy, so pharmacy owners in states with the Death with Dignity Act is applicable must determine whether their establishment will participate in physician-assisted suicide. Therefore, all of their employees have written policies and procedures so that anyone who is consciously objecting to the procedure may choose not to work at their establishment. As the debate over physician-assisted suicide continues, it's important to know your own stance and have reasonings to establish it, but also to know how it would affect your future professions and the world around you. The most important thing is to be educated.